if one state is opening its door to outbreaks, that's going to spread to all of us. We can't have a smoking section in the plane. We all live in this country. The Supreme Court said the state can put in place reasonable restriction of individual rights for the public health. Colleges that opened had more outbreaks, and the outbreaks went to the community. There's a lot of evidence that shows that states with stronger vaccine mandate laws have higher rates of vaccines among the children and less outbreaks.
Before we get strictly into the school mandates, I want to ask the first general question. Are school mandates constitutional, or what kind of legal precedence is there for putting them in place for COVID like we have with other vaccines?
So I'm going to separate the two questions out. Yep. First, in terms of school mandates generally, in the past 100+ years, no court that looked at this, state or federal, have found the school mandate unconstitutional. And courts have repeatedly said, yes, they are. Why do they do that? Because school mandates sit in a place where two really important interests meet. First, the interest of the child. For vaccines generally, the benefits of the vaccine outweigh the risk. So it's in the interest of the child to be vaccinated, and school mandates are very effective at getting parents to vaccinate. Second, they protect the public health, and they do it in two ways. First, inside the school. Children are close together in the school. It's kind of an excellent breeding ground for germs when you put a lot of kids together. Kids aren't as careful as adults in washing hands and everything, hoping that most adults are careful, which I'm not sure. So kids, when they're together, if there's a disease, it will go around. So the vaccine keeps the school safe for everybody. And if the disease spreads in the school, it then spreads into the community. So it infects the young brothers and sisters of the children, grandparents, everybody else. So vaccine mandates protect children and the public health, so they're generally constitutional. And I'll add, there are some caveats on that. I hope you talk to me about religion a little later. Mm-hmm. For COVID-19 vaccines, they'll probably be as constitutional as others. The issue is political. So far, no state has really adopted the COVID-19 vaccine mandate for school. And I think that's probably a good idea, because one of the things about vaccine mandates, one of the hidden things is, so there's two questions. Are they constitutional and are they a good idea? And those are different. Yeah. Vaccine mandates are a good idea when there's quite a bit of consensus behind the vaccine. And the issue is getting the few parents who think it's not worth their time or who are not sure to vaccinate. If a large proportion of the population isn't sure, we're probably not ready for a mandate. And I think that's where we are in COVID.
Yeah. And so then I guess before we get into maybe some of the benefits or the reasons why these are good things or could be seen as a good thing, another clarifying question, just so everyone listening maybe knows, and I'm sure I figured it might come up somewhere along our discussion. Could you define what herd immunity is, why it's like what's aimed for? And then if you know what it is, what is the goal that we're aiming for with COVID?
Great question. So herd immunity, which is also referred to as community immunity, means that there's enough people in the population that are immune to a disease so that even if the disease comes in, and disease come in all the time, it doesn't spread. So the people who are immune kind of create a circle about newcomers that have the disease, and it can't jump to other people. And you can be immune by getting the disease, and then your body creates an immune reaction, or by vaccinating and not getting the disease. For COVID, as you probably know, it's a little trickier. Same for influenza and same for example, for colds. There's two things. First, there's several strains of COVID. So immunity to one might not get immunity to another. And the other part is for respiratory diseases, for at least respiratory diseases like influenza, colds, and COVID, we're not very good at creating long-term immunities. We get colds again and again. We get influenza again and again. Partly the viruses mutate, but partly it's also our immunity wanes. So for COVID-19, the immunity from the vaccine at this point isn't long-lived.
Yeah, so I want to go into the different kinds of schools. I know like public schools and colleges, starting with public schools, because on my channel, we cover a lot. I don't know how much you keep up with politics. We covered Trump and how he says that he's not going to fund any school that has vaccine mandates. So I have kind of a two-part question. First is, would that be possible? Does he have that within his power to do so? And then second, can you maybe explain the goods that come with vaccine mandates as to why that is not a good idea?
Yeah, so starting with your first, this is a great division. You're asking me first about the can he do that and then about the should. So let's start with the can. The short answer is that vaccine mandates in schools are state creatures, not federal creatures. The federal government doesn't have authority to directly order states. And by the way, most of the funding for schools doesn't come from the federal government. It comes from states and local governments. So he can't tell states, remove your vaccine mandates. What he can do is, and that's going to be a little more complicated than he seems to think, because a lot of a lot of education money is allocated by Congress. And all the administration gets to do is implement the programs that Congress put in place. So if Congress said you should give money under this condition, he doesn't have the authority to just throw those rules out. He might try, but that would be challenged in court. What he can do is some money is discretionary. And for those, the Department of Education can set conditions. Is it enough to push states to do away with vaccine mandates? Probably not, but it's going to be a case-by-case question. So he can't remove vaccine mandates. He can limit some funding if he doesn't like it. It's probably going to be politically unpopular because although vaccines have become more politicized, there's a vaccine mandate in every state, Republican or Democrat governed. And there has been at least since the 70s and 80s. And here we go to your other question, what's good about school vaccine mandates? So remember that in most states, school vaccine mandates have exemptions. Parents who really feel strongly against them can usually get out of them. But what they do is two things. First, they do push parents to vaccinate. So parents who say, we're busy, we don't have time, can't get to the doctor. And by the way, remember that in the background, beside the mandate, are the access issues. Sometimes for some parents, it's hard to get to the doctor to vaccinate. The mandate will push them to get the vaccine. And for parents that are hesitant but not opposed, the mandate will also be a tipping point that will get them to get the vaccine. So vaccine mandates, we know, increase the rates of vaccination in school. There's a lot of evidence that shows that states with stronger vaccine mandate laws have higher rates of vaccines among the children and less outbreaks. So we have that evidence too. So more vaccines, less outbreaks, and stronger vaccine mandates, more vaccines. So it protects the children in the school and it protects the community as well. So that would, if he goes in and fights against school vaccine mandates, we'll have less children protected and potentially more dangerous diseases.
So I want to ask with how the data kind of clearly bears out these benefits, and this is more your opinion kind of, but because anti-vax certainly existed before COVID, I'm sure it'll exist long into the future. But what about the COVID phenomenon specifically, do you think kind of created this more larger group of people who deny it's real, deny the effects of vaccines, the benefits you could see from mandates, and the other long list of conspiracies that kind of come with it?
I think you're hitting on a very real problem we're facing. Until COVID, vaccines were not a political issue, not an identity issue. We used to say that the anti-vaxxers kind of go to the two edges of the political spectrum, the extreme left and the extreme right, for different reasons. Now with COVID, since the pandemic has been politicized, that rubbed over onto vaccines generally and vaccine mandates specifically. So we're seeing a more political approach to vaccine mandates. We're seeing, for example, Fox News has platformed quite a few anti-vaccine activists, which means that people who trust Fox News get bad factual information about vaccines and about vaccine mandates. It didn't used to be an issue, and it's rubbing on to vaccines generally. For example, Mississippi, which used to have, surprisingly, one of the strongest vaccine mandates until recently, had another case, one in a long line they had against the vaccine mandate, and the Attorney General essentially threw the case, basically didn't argue for the mandate, with the result that now Mississippi has a religious exemption where it didn't used to have one. This was the one health measure on which Mississippi was doing well compared to other states. Mississippi is a poor state. I'm not saying anything to criticize. They have large rates of poverty, high rates of poverty, and it affects their health metrics across the board, except for vaccines where they were doing remarkably well and they didn't have outbreaks that other states have. Now it's changing. So the politicization is costing us directly. And remember that even if you're saying, well, maybe I'm not in one of those states where the politicization is undermining vaccines, we can't have a smoking section in the plane. We all live in this country. People travel across states and disease travel across states. We meet people in the airport, etc. If one state is opening its door to outbreaks, that's going to spread to all of us.
And that's, I think, a great point that you make, and kind of sums up where I think most people should be on it, because it's not like an individual choice that only affects you with these things. If you go out and catch COVID and most people aren't vaccinated, we don't have herd immunity, it affects everyone. So before we jump over specifically more into some of the college stuff, I wanted to ask if you could explain the Jacobson standard and if the COVID vaccine clears it, meets it, or if it's been looked at in that regard at all.
Yes. So in 1905, Pastor Jacobson was told to get a smallpox vaccine because there was an outbreak of smallpox and people were dying in Cambridge, Massachusetts. He refused, and under an existing law, he was given a $5 fine. He appealed it all the way to the Supreme Court, and the Supreme Court ruled on a number of things. And Jacobson basically made two types of argument. One, he said it's not constitutional. And the other, he said, vaccines are bad, and here's my science from the anti-vaccine movement at the time. So it really reflects the struggles we're seeing today. The Supreme Court said the state can put in place reasonable restriction of individual rights for the public health. And on science, we're going to defer to the policymakers. In other words, it's not the job of the courts to decide scientific controversy. Jacobson stands for the idea that you can put in place reasonable limits on individual rights in the public health. That means you can't just limit rights in the public health because you feel like it. You have to justify it with some reasonableness, but the courts are going to be differential, give some respect to the policymakers in terms of what's reasonable. So Jacobson has two parts. Part one, the restrictions on individual rights have to be reasonable. Part two, on what's reasonable, the courts are going to defer to the policymakers. There's some leeway. That's still the rule, and the courts applied it specifically to vaccine mandate and said vaccine mandates that protect the community from a disease are usually reasonable. And several years later, in a case called Zucht versus King in 1922, the court said this applies to school mandates as well, even if we're not in the middle of an outbreak. So you can require vaccines in school to make the community safer. So that's Jacobson.
Awesome. Yeah. So before what were you saying? You can go ahead.
I was saying it's still applicable. It's been litigated a lot during the pandemic, and by and large, with very few exceptions, mandates that were subject to a Jacobson analysis survived. It's in religion where we had the most struggles.
Yes, and I do want to ask you about religious exemptions also going down the line. But first, before we get to some of the measures the colleges put in place for these and things we see, what kind of effects did COVID have on the colleges? Not just from infection rates. I know some didn't want to go remote and stayed in person, but even to like grades, costs, maybe from shutting down. What were the overall effects?
So COVID hit colleges and schools extremely hard. Schools felt that they needed to close relatively early. You may remember it. So in March 16, 2020, 6 counties in the Bay Area issued the first stay-at-home orders, and colleges closed almost immediately after that, not just in California, in most states. And closing means they went remote, which wasn't ideal for anyone. So there's two parts to this. First, you can have a good online education if you plan for it. Going remote in the middle of the semester isn't the way to get there. So you had courses that were designed to be in person suddenly move online. That hurt the students because they were suddenly learning from professors that didn't have experience with online education, online courses that weren't designed for it. The other part is that there are real costs for students and for the university in moving online. First of all, online education may mean that there's not as much a sense of community. So the students were isolated. I heard that from my students. A lot of students really were isolated. Second, it requires the infrastructure. And I have students here who live in houses where they don't have great internet or and they might not have a laptop that can handle a lot of Zoom. Or that there's other demands. If you have a small house with parents and children and so forth, there might be other people that may be looking to use the internet. So it hurts students, and it hurts students that were in more vulnerable positions more. It hurt the colleges because suddenly college facilities stood empty. You still have to pay for those facilities. And there wasn't the ability to give students access, for example, to exercise, gyms, walkable areas in the same ways, especially at first. And it wasn't great for professors who may not have had as much internet as well. So it was hard all around. As you correctly said, we have seen, especially in the early days, that colleges that opened had more outbreaks, and the outbreaks went to the community. So we have quite good evidence that going online probably reduced the rate of outbreaks, probably saved lives. Remember, although we think of students as young, fit, we do have quite a few students with medical conditions. We have students that live with people with medical conditions, and we have teachers, teaching assistants and professors who have medical conditions, and all of the above can be younger or older. So it protected students' life, it protected their families, but it wasn't easy.
And just because of that, like not being easy and the colleges needing to open back up, whether it be costs or grades or whatever the reason being, did you see colleges turning more towards mandating the vaccine? What kind of procedures were they going to implement this? And was there a benefit in schools that were requiring vaccinations?
Yes. So colleges were very anxious to reopen, and vaccine mandates. So there were already mandates in many colleges for the other vaccines. So vaccine mandates were a natural tool for them to reach, to try and say, we're opening, but we're taking safety precaution to keep our students safe while opening. And that was stronger in the earlier variants of COVID, which, to remind you, were a better fit for the existing vaccines and were more severe. And it was a good argument at the time. Today, so remember that this changes over time. In the early days, a lot of people didn't have any immunity to COVID. Most people didn't get COVID at first, at least in part thanks to closures. And there wasn't any good treatment. So the vaccines were a way to say we're going to reduce the risk of infection. We may not completely prevent it. No vaccine is 100%, but reducing the rate of infection could save life, could reduce the harm to the community. And I think we have good data that strong vaccine mandates in the colleges did reduce infection rate in the college and did reduce infection rate in the community, especially in the early stages. I will add two caveats. One is some colleges had a mandate, but had a pretty easy to get exemption. So for example, Indiana University had a mandate, but added a religious exemption and medical exemption. And for religion, they basically granted all the exemptions that were submitted. I know Indiana because there was one of the early lawsuits against university mandates was in Indiana. So they had a mandate, but they had a very easy to get exemptions. That kind of makes the mandate an opt-out from the vaccine. It's a weaker mandate, but it's better than nothing. Again, the goal is to reduce risk. You're not ever going to completely eliminate it.
Yeah, and you kind of got into what my next question was going to be as to what kind of hurdles did these exemptions put in place. I know that in one of your papers, you kind of spoke to how there were more, it used to be a little more strict with the religious exemptions, but now it seems they're giving them to anyone, even if it doesn't go against the denomination they're claiming and stuff. So what kind of hurdles do these things present?
Good. So there's basically three types of exemptions. Medical exemption usually require you to get a confirmation from the doctor that you cannot safely get the vaccine. That's probably the most justified and the most limited exemption, because there are only some things that are conditions, but there are, of course, doctors that are willing to sign on anything. So there's a question, how do you police them? Religious exemption are the trickiest. And why are they the trickiest? So if you could read people's mind and say, these are the few people that really have a religious objection to the vaccine and give them the exemption, that would be easy because there aren't a lot of people whose opposition to vaccine is really religious. Mm-hmm. And those probably wouldn't undermine herd immunity. They'd probably be a minority, but you can't. you have to trust their word. And a lot of people, we know from past experience from schools as well, are willing to lie and say that the reasons for refusing the vaccine are religious, where they're actually scared, often because of misinformation. So the question is, as you're saying, how do we police religious exemption? And we've saw a variety. Indiana accepted every religious exemption, but other universities put in place a procedure. Some of them had a committee to review each exemption. Some of them had a questionnaire, and it really varied. And the harder it is to get the exemption, the less exemptions you'll have, but also the more likely you are to be challenged in court. And we had very extensive litigation. One of the things that's been happening since 2020, and you can time that because Justice Ruth Bader Ginsburg died in September 2020, and Justice Amy Coney Barrett was confirmed at the end of October that year. Mm-hmm. The Supreme Court moved from being relatively differential to limits on religious activities to being very aggressive in striking down measures that limit religion almost overnight. So one of the challenges right now is challenges that say you're violating my religion are a lot more likely to succeed. So it's harder. There's a lot of battles around religion. I will say that still, most universities won on their vaccine mandates, even in religious claims, but a few didn't.
And towards the end of one of the papers that you did link, I was looking over and I was intrigued by how you didn't suggest just one policy, but instead you had a list of options of different ways, the different issues the universities may face and the different ways they could tackle them. Now, I'm not going to ask you, verbatim to list each one, but could you maybe expand on some of the different ways that universities could go about ethically and practically implementing these measures?
Yes, the first point I want to make is that whether a vaccine mandate is constitutional is just one question. As we said earlier, it's really important whether it's a good idea, and that varies. If in some universities, the political environment is not going to be friendly to vaccine mandate, if the legislature is going to step in and overturn your vaccine mandate, it's probably not a good idea. In others, you have a university that's isolated enough or that has only contact with communities that are at low risk. And there, maybe a mandate doesn't make sense. In some universities, it's harder to go online than in others. So, for example, a medical school or a hands-on school, a dental school, a veterinary school, it's much harder to go online. So what's the right answer is going to vary by university and potentially by school as well. So the options we discussed told the universities, these are the things you need to consider. And among the various things, so one option for the university is open completely, don't have a vaccine mandate. You have a low risk. Maybe you're isolated. Maybe the COVID isn't an issue in your area. Another option is don't have a mandate, but have alternative measures. Everybody has to mask. Everybody has to test. A third option is have what I call a soft mandate. Mandate or vaccinate and test. You don't need an exemption. You don't want to take the vaccine. It's free. There's no special requirement, but you have to do certain things that other students don't. Another option is a mandate with real exceptions. So a mandate that has a religious exemption. And again, it varies how strict you're going to be on it. And the medical exemption. A medical exemption is almost certainly constitutionally required because for the few people that have a real medical reason not to vaccinate, it's unfair to require them to vaccinate. And the last option is to say, if you're not vaccinating, you have to attend classes online. So kind of say, we're not going to force you to vaccinate, of course, but you vaccinate, you have to not attend in person.
Awesome. Yeah. And I think that covers most of the questions that I had. I always like to give people at the end, if there are any topics we didn't get to that you want to be sure to hammer home, or if there's any other things you want to shout out, I want to give you the floor so you have a moment to do that.
So two things that might be worth raising. One is we focus on educational mandates that are really important, But the other big place we've seen mandated work is in the workplace. And I want to point out that it's a little different in the workplace, because if you're a business owner, it's not just about safety. You may have a financial interest in saying, I want my workforce to be healthier and not stay home from COVID or not die from COVID and so forth. So you may have another argument for a mandate, but there's also a backdrop to that, which is in the workplace, we have if you are imposing a mandate, there should be workers' compensation if anyone's hurt from the vaccine. And related to that, one of the things we didn't talk about is the complement to mandates need to be a very good system to compensate the rare cases of vaccines harms, because it's unfair to mandate the vaccines if you don't cover potential injuries. We need to improve our compensation system for COVID-19 vaccines. We have a good system to compensate for childhood vaccines, but not as good for COVID vaccines. The other elephant in the room is, of course, the anti-vaccine movement and the way they took advantage of the pandemic. The anti-vaccine movement has increased its funding dramatically. For example, Children's Health Defense, Robert F. Kennedy's organization, increased from less than $2 million before the pandemic to $23 million in 2022. So they're much richer. They're doing a lot more work. You correctly pointed out that part of what's going on is politicization and certain political activists promoting anti-vaccine misinformation. But the other part is that the anti-vaccine movement has more money now to promote misinformation and litigate, and we should be worried.
Awesome. So thank you again for lending us your expertise for a little bit. And I'm glad that we could make this happen, and maybe going forward, we could do another one.
Thank you for talking to me.
Awesome. Enjoy the rest of your day.